Good morning, December 10, 2024. I'm Dr. Ara Duke-Majan, CEO and founder of Duke Spine Institute. Our patient travels from Arizona to Florida. He's got neck pain. His MRI shows two very small disc herniations. Most doctors ignore it. They tell patients like this, there's no cause for your pain, just live with it, take pills, maybe do some shots, some therapy, but the sad truth is therapy, shots, pills, nothing is going to fix his pain except for surgery. And of the type of surgeries available for him that would cure his pain, there's two. One is fusion, which is highly invasive, has complications, requires narcotic painkillers, and the Duke laser disc repair. He found us on the internet. He watched hundreds of videos of the Duke laser disc repair, which is what we're going to be doing today. The Duke laser disc repair has the highest cure rate of any treatment in the world for neck pain and back pain. And that is because 85% of neck and back pain comes from disc injuries, and the Duke laser disc repair targets those disc injuries with a 99.6% cure the pain from the disc rate. So 85% of pain in the neck and back, chronic pain, comes from disc injuries, and Duke laser disc repair, the surgery we're about to do, cures 99.6% of that pain on average. Okay, we're going to get started. This is the right side of his neck. First thing I do is place the needle shot. We're going to do 2, 3, 4, 5, 5, 6. Everyone agree? 4, 5, 5, 6. So I'm going to start with my needle over the C5. Everyone agree? 4, 5. It's not 3, 4, 4, 5. It's 4, 5, 5, 6. 100%. Everyone agrees? Dr. Berndes? 2, 3, 4, 5. I'm over 5. I'm going to slide down, shot, and I'm going to do 5, 6 first. Shot. All right, now let's get an AP view. Wait, let's just see. Shot. Give me a lateral. We're using the X-ray to guide the surgery, so I'm going to go in. Shot. Let's just get a quick AP and see where we are. Now, most surgeons don't know how to do this surgery. It's a surgical technique I learned from the Koreans overseas. That looks good, Jordan, don't you think? We're right in the middle. Yes, you agree? Jordan? Yes, sir. Yeah, I think we are. I learned the technique here you're watching from the Koreans. The first in the world to do this transdiscal surgery were the South Koreans, Dr. Sang-Ho Lee, Dr. Gun Choi. Let's get an AP. Mostly Dr. Sang-Ho Lee. He was the founder of the Woodidal Hospital in South Korea. Now, he pioneered the transdiscal endoscopic surgery, and I'm using that technique to go in and repair this patient's discs. All right, I want to just verify. Let's get a lateral again. I may want to do another AP positioning. Yeah. I want to see if I can pull the needle back a little bit and verify its position on AP. Shot? All right, so that's at the beginning of the disc. Let's get an AP again and just see where it is. It moved. So we're going to have to redo it. Try to go in the same little skin hole. His neck is supple, which is perfect. That's exactly what I want, a supple neck. Supple means that his muscles are relaxed. Shot. 2, 3, 4. Everyone agree? 5, 6. Going in. Shot. Let's get a quick AP. AP means front back. I need to look at the position of the needle at the front of the disc. Is it off? Is it in midline or is it off midline? That's a little bit off to his left. I'm going to reposition it. And shot. Perfect. Now we're dead center. You can see the dead center right on top of the spinous process, which is in the midline. We use the X-ray to guide us. Perfect. We're in the dead center on both AP and lateral views. That's what we want. Shot. All right, we are inside the disc at this point. I'm going to do a discogram, which is where we inject dye. And what we're going to expect to see, let me just verify with my team which level we are. And it's very important that surgeons use their teammates to help them in certain parts of the case. I can't do this by myself. So everyone agrees we are at 5, 6. So 2, 3, 4, 5, 6. And you have the consent form for surgery? And 5, 6 is the bottom of the two discs, correct? Can you verify that? 4, 5, 5, 6. So we are starting at the bottom of the two discs, 5, 6. We're going to finish this disc repair. We're going to come out. We're going to move up one disc, and that will be the two discs we're fixing today in this patient. Everyone agrees? Yes. Henry, for our audience's benefit, let's show them, Sean, the 30 causes of neck pain, chronic neck pain, because there are 30 different things that cause neck pain, but they all don't equal, like they're not all at the same frequency. Some are far more common, like disc injuries. Before you start, I'm going to do my discogram, and let's just verify. Shot? All right, there it is. You guys see the tear? There it is.
Yes,
Show
we
us
do.
the tear, Jordan. Beautiful. So there's a tear in the back right there, and there's a tear in the front. And you can see the dye leaking out the front tear and the back tear. Now, front tears never cause pain. It's only back tears that cause pain. And with that, let's go ahead and we're going to place our tube to do the surgery and our endoscope. You guys are going to watch a quick video on how, what are the different causes of neck pain. I'm Dr. Duke Machen, CEO and founder of the Duke Spine Institute. We're going to talk about the 30 causes of chronic neck pain. Chronic neck pain is neck pain that lasts longer than 6 weeks. There are 30 causes to chronic neck pain. The most common cause is the disc. There are 6 discs in the neck. These discs can become injured. The first disc is C2-3. Next is C3-4, C4-5, C5-6, C6-7, and C7-T1. The most common disc to be injured and cause neck pain is C5-6, followed by C6-7, followed by C4-5. The other discs rarely cause pain. Discogenic pain represents 85% of chronic neck pain. Next, the facet joints cause 10% of chronic neck pain. Facet joint pain is very common in patients with neck injuries and spine injuries. Facet joint pain is usually located on the sides of the spine, either right, left, or both. Facet joint pain gets worse with rotation of your head and neck, worse with extension. The most common facet joints to be injured are C5-6, C6-7, and C4-5. C7-T1 is another common facet joint to be injured. These joints, after injury to the capsule, will develop arthritis. It is the arthritis in and around the facet joint that causes the neck pain and stiffness with movement. Duke plasma rhizotomy is the best treatment in the world available for painful facet joints. Duke laser disc repair is the best treatment in the world available for painful discs. Other causes of chronic neck pain include fractures, tumors, infections, and muscle spasms. These other causes represent less than 1% of chronic neck pain. Thank you for joining us for 30 causes of chronic neck pain. Welcome back. We're going to talk about the video you just watched in a moment, but take a look at this x-ray. You can see the tip of the dilator is in the middle of the spine, right in the middle of the disc. We're entering from the front, going to the back. We're going to head off to the left side. That's where most of his symptoms are. And there's a very faint blush, we call it, of dye. You can see that the dye is leaking out the tear on the left side. The whole surgery is done through this tiny incision, shot. It's a 4mm incision in the skin. That's like just a pinprick almost, shot. At this point, I have to advance my dilator into the front of the disc, the annulus, and I'm going to bring it from the front to the back. Shot. All right. Shot. I could feel it going through the annulus. We're now passing through the jelly, and we're going right to the back of the disc. Shot. All right. Huh? We don't need inline. You can see the dye still in the back of the disc where the herniation is. You guys see that?
Yes, we do.
Right there. All right. Now I'm going to put the tube over the dilator, and I'm going to bring this tube down. This tube is 4mm wide. Shot? You guys see it? Shot?
Yes, we do.
The tube is right there. It's near the front of the spine. And I'm going to advance the tube through the disc. Okay? The tube is where we do the surgery. We do the surgery through that tube. Shot? We're going to remove the dilator once I get the tube in position. the whole surgery is done through a tiny tube, so there's no need for opening up the body. Everything is done minimally invasive, endoscopic, through a tiny little tube. Shot. Shot. Any questions?
At this moment, no current questions.
Let's show the audience, Henry, how is it that a disc injury can be so painful? Because you've just watched the video on the 30 causes of neck pain, and you can see that of the 30 causes, the most common cause is a disc injury, and that accounts for 85% to 90% of chronic neck pain. Shot?
Disc injuries start with an annular tear. Damaged nucleus pulposus herniates into the annular tear. The herniation triggers an inflammatory response within the annular tear. The inflamed annular tear generates pain signals. For more details, please visit our website at www.dukespine.com or call us at 1-800-FIX-MY-NECK 349-6963.
Welcome back. You can see from the video that the disc injury causes inflammation in the back of the disc, and that's where all the symptoms of neck pain, headaches, arm pain come from. They come from inflammation in the back of the disc. Now, when you have a tear in the front of the disc, it does not cause the same symptoms, because the pain fibers that experience pain and bring the pain up to your brain, those pain fibers are not the same on the front of the disc and the side of the disc as they are in the back. The back of the disc has special fibers that project to the part of your brain that tells you you're having very localized pain, called localized pain. And that's called the primary somatosensory cortex. All of this was figured out here at Duke Spine Institute first, and we're literally 30 years ahead of the rest of the world in treating these pain conditions. Unfortunately, there's a lot of special interests in America and the rest of the world, companies that make billions and billions of dollars profits selling you guys and hospitals stimulators, implants like screws, metal plates, cages, rods, devices that cost money to buy them and implant them. And these companies are now controlling our educational platform, and they're teaching the surgeons how to treat patients. It used to be that surgeons would teach the surgeons how to operate, that surgeons would teach other surgeons how to do the best treatment for the patient, what's best for the patient. Now, with these companies that are making billions of dollars profits off of treating back and neck pain, these companies want metal and what are called modulators, neuromodulators, put into patients. And so to make the giant profits they make, they need surgeons to be putting these devices in patients. And they're really pushing surgeons to do that. And there's 3 ways that you can do that. One is in the training centers where surgeons are trained. Number 2 is at our meetings that we go to for educational meetings. They're called CME, Continuing Medical Education Meetings. And 3, the journals, where all the research is published, and that journal articles influence what doctors choose for their patients. So these companies have taken control of our training centers, they've taken control of our journals, and they've taken control of our academic meetings, our scientific meetings where we go to learn every year. And they are now literally bribing the people in charge with money to basically promote their devices. And I'm seeing it firsthand, and it's undeniable, and it's very, very, very much against the interest of patients. It is going against people's best interest. It is harming people. And I am trying to raise awareness of this by talking about it and educating the public about it. But I am literally one voice in in millions, and it is so hard to do. But I feel like people are being taken advantage of and being harmed for profits of large companies, and this is wrong. These problems of neck and back pain can now be cured quite simply and easily with this simple surgery you're watching. No metal, no device, it's one and done. Now, if the metal and devices provided just as good a result, then it would be okay, you know? It would be somewhat okay. It'd still be too invasive, too much, but at least it would be giving patients relief that they need and deserve, and it's permanent relief. But the truth is, these devices, these neuromodulators like these spinal cord stimulators, which are being promoted heavily, these devices do not give the patients the relief they need and deserve. They give them partial, if any, relief, and it's short-lived because the pain always comes back because the stimulators stop working, which is just fine for the big companies because then they can sell you another one to replace the one that stopped working. It's absolutely horrific in my mind what's happening, and I think people need to know the truth. The only way change is going to come about is if people know the truth and they go out and they advocate for their health in mass. In mass means large numbers, okay? You know, one voice is not enough. But what the evil that's happening in the world right now in medicine is getting worse, and people are suffering, and they should not be. And I'm a victim as well of this scheme. You know, I have had my own medical issues, and I'm finding out that the treatments recommended by doctors are always in line with what the industry, the companies that make profits from selling you medicines or selling you treatments that don't work, and then you have to have additional treatments afterwards. So I'm trying to raise awareness about this so that people can advocate and do what's right for themselves, but it's not easy. Do we have any questions?
Yes, we have a comment and a few questions. This comment is coming from Jerry on Facebook.
Hi, Jerry.
Saying, Jerry in Nam, Dr. Duke, just like to wish you, your family, and the staff a very Merry Christmas and Happy Holidays.
Jerry, thank you so much. So great to hear from you. I hope you're doing well. And yeah, we really appreciate the sentiment and the comments. All right, so thank you, Jerry. We've talked, this is all, by the way, for those of you who don't know, this is the bottom of the tube. We are at the back of the disc. That's the tear right there. You're looking at what's called the posterior longitudinal ligament. We are really at the back of the disc. And look at all this little white stuff. These are all pieces of calcium and scar tissue because there's been inflammation going on. That's the only way you get this stuff. This is scar tissue right here from inflammation. The only way you get this is inflammation. The only way you get inflammation is when your body is attacking something it doesn't like. And what it doesn't like back here is the herniation. It doesn't like the jelly that was in the middle of the disc. Now it's sticking out back here. It can be seen by your vascular system, and your inflammatory system is attacking it. And that goes on for years and years. It can go on for 20, 30, 40 years. And people can be in pain for that long. But this simple Duke laser disc repair surgery you're watching, we use this laser to remove. And by the way, that laser fiber is 0.5 millimeter. That's 0.5 millimeter wide. That gives you perspective on just how accurate and precise this treatment really is. This is scar tissue here that I'm working at 12 o'clock. I'm moving towards his right. The biggest problem was more his left. And so we've already addressed the left side. I'm coming back to the middle just to make sure I get it all. I don't want to leave any herniation here. Now the pieces that I'm blasting out with the laser, they come and they float up and out the tube. So they don't stay in the body. They come out. This is really the end of the herniation right here. There's nothing more past this. So we are on the left side primarily. There's a little piece of herniation there we're going to get, but we're pretty much done with this disc. Okay, we're pretty much done with this disc. A little bone spur right there, you know, right there. Now the precision of this laser is literally, if the width is 0.5 millimeter, I can actually do 1/20th of a millimeter of tissue removal, 1/20th of a millimeter. There is no surgical tool in the world besides the endoscope and laser that allow for this, just so you know. If you're talking about traditional surgery done elsewhere, there's no surgery that is this precise. This is at least 20 times more precise than any other spine surgery in the world. And people talk about lasers, they're afraid of them because the doctors that do the metal, they do the implants, they don't want you finding out about this surgery, they don't want you having this surgery because this surgery actually works. And it's going to put them out of business, it's going to put the companies out of business. This patient figured it out. He came to us from Phoenix, Arizona, on the other side of the United States, and he's getting his neck fixed today, the right way. Now, this is a natural solution, and Henry, let's show the audience how the Duke laser disc repair works.
Of course.
In the neck.
Disc injuries is a common cause of chronic neck pain. The inflamed annular tear causes neck pain. A 4mm skin incision is made. A small tube is inserted with no damage to the bones or soft tissues. The laser removes herniated disc fragments and debrides the posterior annular tear. The annular tear heals on its own after the procedure, which can take up to 12 months. For more details, please visit our website at www.dukespine.com or call us at 1-800-FIX-MY-NECK 349-6963.
Okay, welcome back. I just want to show you this. Look inside the tube at the tip of the laser. That's a piece of herniation right there. See? And the tube inside is about 3 millimeters. So here it comes. It's coming out. This is a kind of a bigger piece, so it's taking its sweet time to get out. But we're using the fluid, you know, the movement of water, basically saline, sterile saline, to lift out the pieces of herniation that I've released. And I just want to make sure we get them all. There's another little piece. And by the way, a lot of people think a herniated disc is just one piece of herniation. It's not. It's about 25 to 30. We found at Duke Spine the average is around 25 pieces of herniation by the time we get in and fix somebody's disc. And every time you get a new onset of pain, you probably shot out another piece of herniation. By the way, I just watched the movie Gladiator 2. I don't know if anyone else has seen it, but it's actually pretty good.
Not yet. I was hoping to. Very soon.
Yeah. All right. So, Henry, we'll take some questions.
Yes.
And then we're pretty much done with this disc, so I'm going to move on to the next one. All right?
Copy that.
I just want to get this last little straggler here.
Of course. This next question coming from Charlie on YouTube.
Hello, Charlene. Welcome.
Charlie asked, could you explain the advantages to using an interior approach as opposed to a transforaminal endoscopic approach for decompression? Also, your thoughts about uniportal versus biportal endoscopy?
Yeah, great question. So first of all, I don't know if you're talking about lumbar or cervical discs, but this is cervical in the neck. If you decide to go transforaminal, you have to go in the back of the neck. That treatment does not work well at all. The results are very poor. And if they work, it's temporary, because to go in the back of the neck and do transforaminal, you're going to be taking out bone and ligament. Namely, you're taking out part of the lateral mass, the facet joint, and the ligament stabilizing the joint. That's the only way to go in the back of the neck to do this. This transdiscal approach is the safest and best treatment there is. You're not doing any damage to any part of the disc. You're just going to the tear and the herniation and removing them. So it's least damaging treatment. This doesn't cause any damage at all. Whereas transforaminal causes a lot of damage to the back of the spine. It's permanent, and the damage you're doing is to the bones, the joints, the ligaments, the facet capsule, and the muscles. We don't want to do any damage. It's a much worse technique to go transforaminal cervical. Now for lumbar, we go transforaminal, and that's the best way to do it. But this is cervical. This is the neck, not the back. For lumbar and thoracic, we go transfemoral. transforaminal. As far as the biportal technique, it's a worse technique. Once again, it requires 2 ports instead of 1, and there's removal of normal tissues to do the surgery because you're actually going translaminar, you're going through the bone and ligament. So the surgeon has to remove normal structures like muscle, ligament, tendon, joint, bone. The surgeon has to remove all those to get to the disc with this UBE, unilateral biportal technique. It is a worse technique. So why do surgeons do these worse techniques? The answer is simple. The techniques that I use are very, very technical, and most surgeons are not capable of doing it. The companies that make the equipment for the UBE, they want to sell their equipment, and so they promote their technique, even though it's worse technique, because they make more money selling things. They don't make much money on us for the surgery because we're not putting anything in, we're not using any disposables, not too much. So we're actually saving money. This is a much more cost-effective, safer, and better procedure with better results. All right, I'm going to take this tube out and leave the dilator. Shot. So I disconnected the fluid adapter, which I didn't want to do, and I need to put it back. I need the fluid adapter connected to take the tube out. Sean? So we're going to leave the dilator. We're going to take the tube out. Sean? I'm going to monitor my progress. You guys see the tube coming backwards? Jordan, show them. Sean?
Yes, we do.
All right. That's the tube. Shot. Yep, I'm almost out of the disc. Shot. I've got to watch my dilator tip and not push it in accidentally or pull it out accidentally. Shot. So I'm out of the disc at this point with the tube, and I'm going to leave the dilator in the disc. I'm going to take the tube completely out and give it to my assistant, Luis, and we're going to replace it in a moment, but until we do, I've got to advance. By the way, we have lost 1 drop of blood. With the UBE technique, other techniques that are more invasive, you're going to lose a lot more blood and create more pain. Sean? All right, we're going to move the dilator out and up 1 disc. Here we go. This is called the Duke spine slide. Sean? Because we're sliding up the spine. We pioneered it here at Duke Spine Institute. I did as the founder and pioneer, Dr. Duke Majan. And it allows me to treat more than 1 disc at a time. Sean? If you don't do the slide properly, you can only treat 1 disc at a time. When I learned the endoscopic transdiscal technique from the Koreans almost 20 years ago, it was 1 disc that they would treat. They would never move to a second disc because there's obviously risk associated with it, and they didn't want to take that risk. But I developed a technique to slide the dilator so I could treat 2 or 3 discs in 1 surgery. All right, and you're watching it happen right now. We use a combination of AP lateral fluoroscopy to make sure I'm in the middle, and I slide right up what's called the anterior longitudinal ligament, which is a very slick ligament. It's slippery, and it's easy to slide up without causing any problems. Shot? But it just took somebody figuring it out to do it. Shot? All right, I'm just at the bottom of the disc at 2, 3, 4, 5. I feel like I'm off to the side a little bit, so I want to verify my position of my tip of my dilator, make sure it's in the middle. Yeah, we slid off to the left a little bit. You see that? So we're going to bring it back to the patient's right. So we're back in the middle. I'm moving it up a little bit. I'm going to verify that I'm in the middle. Shot. I'm in the middle. Show the spinous process there. Spinous process is in the middle. Yeah, show the one there. Show the one there. Yeah, there it is, a circle. I'm right in the middle of the circle. All right. Lateral view. Now I want to enter the disc through the front, in the middle, and go to the back of the disc. This is the next disc we're fixing. Yep, perfect. So I'm in perfect position on both the AP and lateral. Shot. Now he's got a tough annulus. He's got a very firm annulus. So as I do this, as I make progress, I'm going to be checking my position, because when you have a firm annulus, it can push you to the left or right. And I don't want to be pushed to the left or right. We got to stay in the middle. So you got to keep checking. There we go. We're still in the middle. You know, that's a mistake a surgeon could make, and it could be absolutely catastrophic for the patient if the surgeon does not recognize they're not in the middle. You must use the x-ray. Come on, Jordan. We are now inside the disc. 2, 3, 4, 5. I feel a lot of scar tissue. I think this disc is got a lot of pressure. It's got a lot of pressure. What that means is there's tremendous inflammation happening here. This is probably going to be a very symptomatic disc. Shot. Is that it? Shot? All right. So we just cleaned the end. We're going to do another discogram. Any questions?
Yes, we have a couple questions. This next one coming from Philip on YouTube.
Shot. All right, there it is. Before I take it, look at the tear in the back of the disc, guys. There's the tear right there. You see the dye leaking out backwards. And I'm going to tell you, I was pushing hard on that injector to get the dye in, meaning there's a lot of scar tissue in this disc, meaning this disc is under a lot of pressure, a lot of inflammation. This is a severely damaged disc, and it needs to be fixed with this laser procedure. We're going to get him feeling much better. By the way, the amount of pain relief our patients get with this surgery is about 99.6% of their pain gone with this surgery. 99.6. There's no surgery or no treatment in the world that cures neck pain at 99.6%, except for this one. If you talk to surgeons, they'll tell you the surgery may give you a 50-50 chance of getting better. That's crazy. Who wants a 50-50 chance of getting better with surgery? I want a 100% chance of getting better, and I want to be cured. And that's why we do this particular surgery. Yes, Philip, I'll take your question.
Philip asking, can the Duke laser procedure repair trapped nerves in the foramen? Thanks,
Yes,
Phil.
yes. This surgery does repair trapped nerves. Absolutely. So the nerves are typically trapped in the neuroforamen by the herniation. Okay, it's the herniation that's trapping the nerves. The herniation is pushing backwards, like I talked about, and it's pinching the nerves. All right, so this dilator just keeps moving because I told you it's under pressure, remember? We said that already. Shot? It's literally under so much pressure, it's just pushing backwards. I've got to try to keep it from pushing backwards as I advance the tube. Shot? Shot? Yeah. Shot? Yeah, so I got to advance it again because it's come backwards. And remember, what's pushing it backwards is all the pressure, the hydrostatic pressure in this disc. I can feel it. As I'm hitting the dilator, I'm literally getting resistance, massive resistance, pushing me backwards. And that's because of all the inflammation happening in this disc from the tear in the back. And we discovered this is the cause of neck pain at Duke Spine. So unfortunately, most doctors have no clue about this. They don't even realize this is happening, and therefore they can't tell the patient what's wrong. They can't fix the patient because they don't know the answers. They don't know what's wrong. And what I was taught when I was in neurosurgery training and by pain management doctors is nobody knows what causes pain. Nobody knows what causes this neck pain, this back pain. Nobody knows. So they just treat with pills because pills don't treat a specific cause, and they treat with shots, and they treat with medicine, therapy, chiropractor. All these treatments don't fix the problem, and that's why people are still in pain. But this treatment pinpoints the problem and identifies it and treats exactly that problem. By the way, look how much blood we've lost. Look at this, Henry. That's like 2 drops of blood, the whole surgery. That's it. This is pretty much bloodless surgery. No hospital, it's outpatient, you go home in an hour, and it's a permanent fix to your pain. Yeah, we'll take the next question.
Next question coming from Ping on Facebook.
Excellent. Hi, Ping.
Saying,
Welcome
hi
back.
Doc, what's your thoughts on disc cell that gets injected into the disc to, quote, prop it up?
Yeah.
Wouldn't this just make the herniation worse? I think I remember you mentioning it and not being a fan on a previous surgery.
Yeah.
What would happen if someone did this after the DLDR?
Sure. So disc seal is an injectable medicine, goes into the disc, supposed to seal the disc. It doesn't work. And we've had over 100 patients that had it done, not here at Duke Spine, but elsewhere, and they all say the same thing, it doesn't work. And it doesn't work, so I don't recommend it. It could be dangerous, and I don't recommend it. I would not do it after the Duke laser disc repair. You don't need it. Because what can happen is that material can go out into the epidural space, compress the spinal cord and nerves, and cause paralysis. I wouldn't recommend it. Okay, we're looking at a herniation right here. Here it comes. This is a big one. It's about 3 millimeters wide. Here it comes, up and out, outside. There we go. We just released it out. Remember, each disc has about 30 herniations. Here's another one. Okay, and as soon as we go in and we start the laser up, we're already getting pieces of herniation that want to leave. They're like under so much pressure, they're just trying to get out of here. All right, so they're there. There's your tear right there. There's the annular tear we talk about, and there's a big piece of herniation just sitting right in it. You see that?
Yes, we do.
So we're going to release this, get it out of here, and clean this disc up. Dr. Berndes, we've got 10 minutes to 15 minutes max. I'm letting my anesthesiologist know. See all the calcium there, the gold stuff? That's from inflammation. You do not see this normally in a disc. A disc is normally white. There's no gold. There is no thick material like we're seeing. A disc is normally white without a tear. And you got pieces of herniation. There's another one, just went up. It wasn't a big one, it was a small one. All right, Ping, I would not recommend disc seal. I do not do disc seal because it doesn't work. I don't believe in doing treatments that don't work. As a doctor, my job is to do what's best for the patient, not what's best for the companies that sell things. I do not get kickbacks like other surgeons do. I get no money from the industry. I get no money from anyone but my patients and the insurance company that they have. And that's it, okay? I'm here to do what's best for my patients. People say, oh, you're just trying to promote your technique. Yes, I'm trying to promote it because it works and it's safe and it's the most effective and most durable treatment in the world. All right, Henry, before we take any more questions, we've talked about the 30 causes of chronic neck pain. We've talked about the disc is number one. You know, injured discs are number one cause of chronic neck pain and back pain, for that matter, lower back pain. Let's talk about the second most common cause of chronic neck pain, which is the facet joint. Now, the facet joint is another type of joint in the spine that can get injured, just like the disc is a joint that gets injured. The facet joint is behind the spine, and it's located just behind the spine. And you have, for every disc, 2 facet joints, a left and a right. So the C5-6 disc is the most common disc to be injured and cause symptoms. And the C5-6 facet joint is the most common facet joint to cause symptoms, okay? By the way, this is all scar tissue, this white stuff, with calcification. And this is at the back of the disc where the herniations are. The herniations cause this inflammation, which then cause scar tissue. And we're removing this because inside the scar tissue is herniations. And they're the reason why we have scar tissue. The herniations are causing the inflammation. The inflammation makes scar tissue. All right. From the video we just showed you, you can see where the facet joints are located, and you can see how damaging the facet joint with trauma, which is the same reason discs get damaged, trauma, that trauma injures the facet joint and causes inflammation in the capsule. That capsular inflammation is why facet joints are painful. Remember, inflammation causes pain. All pain in your body comes from inflammation. So without inflammation, there is no pain. That's why people with back pain take anti-inflammatories. Steroids are the most powerful anti-inflammatories, but steroids also have complications and side effects. There's a herniation. Look at the size of that one right there. It's big. It can't even fit out the tube. So I got to shave it a little bit with the laser into a smaller ball. And now I'm going to try to grab it and take it out. Henry, before we take the next question, let's show the audience. Okay, here's a piece of herniation that just came out. You guys see this?
Yes, we do.
It's a little white thing because it's herniation with scar tissue. There it is, right there. Okay? And there's a ruler to give you an idea about how big it is, about 5 millimeters. So it's a bigger one. And remember, most patients that have a herniated disc have about 30 of those per herniated disc. Just about finished here. Let's show the audience how we fix facet joint pain when people have facet joint pain.
Of course.
Facet joint injury is a common cause of chronic neck pain. The inflamed facet capsule tear generates pain signals. The best treatment for facet joint pain is the Duke plasma rhizotomy. The inflamed facet joint pain nerves are destroyed. The advantages with the Duke plasma rhizotomy is that it's an outpatient procedure that takes 30 minutes to complete, very minimal bleeding and pain after the surgery with immediate recovery and return to work the next day, as well as a 99% success rate and permanent pain relief with a single treatment. For more details, please visit our website at www.dukespine.com or call us at 1-800-FIX-MY-NECK 349-6963.
Okay, you've just watched how we can cure facet pain. Is that correct?
Yes. Facetogenic neck pain.
Facetogenic pain. So we like to say genic. Genic means genesis. It's a Latin word. It means the beginning or origin. And when we talk about pain, we want to talk about where is it coming from. And discogenic is a term that was developed to say your pain's coming from a disc problem. So I was not the first person in the world to realize that discs can cause pain. Other doctors had figured that out a long time ago, good doctors, neurosurgeons. The problem is, I'll be honest with you, the insurance companies don't want people knowing that disc injuries cause pain because then people are going to want to get surgery to fix it, which means the insurance companies will have to pay more for more surgery, which they don't like paying for surgery. Surgery is the most expensive line item for an insurance company. There's nothing in medicine more expensive than surgery. So insurance companies have been denying surgeries now for years, not just spine surgeries, but all kinds of surgeries. And there's only one way that insurance companies can deny a treatment that a doctor recommends. And that is they have to use one special word. It's called experimental, and the sequela of that is not medically necessary. Experimental, therefore, not medically necessary. And when you look at your denial, whether your doctor orders an MRI scan or an X-ray or even a special medicine for you, the insurance company is going to say, we don't want to pay for this, and their reason is experimental. Now, the experimental excuse is a lie. It's 100% fabricated. It's made up. It originated many, many years ago when these drug companies were, these are all herniations, when these drug companies wanted to do these drug tests for cancer and other treatments. So they would make a drug, they didn't know if it's going to work or not, and they would then give it to the doctors, and the doctors would prescribe it to the patient or give it to the patient. And then they would bill the, hospital would bill the insurance company, and the insurance company would say, wait a second, this drug is not proven, it's experimental, and we're not paying for it, okay? So the origin of the experimental denial was actually probably reasonable, somewhat reasonable. But they've realized that there's no limit on what they could call experimental. Like, it doesn't have to be an experimental cancer drug. It could be an MRI scan. And nobody is able to challenge them and stop them from doing that. We don't have the power to do it. So that's what they do. They just deny everything now and call it experimental. Or they use the word unproven, because unproven in their book means experimental. And if they say experimental and they tell you, the patient, we're going to deny your MRI because it's experimental, the patients are going to be like, wait a second, MRIs are not experimental. I'm not stupid. So they use the word unproven, which is harder for the patients to understand what they mean. All right, what does unproven mean? It's just a lie that the insurance companies make up to deny your treatment. It's called unproven. Doctors don't recommend unproven treatments. For the most part, we're very good about recommending treatments that we know work. But the insurance companies want to redefine what unproven means and make it something that's convenient for them so they can deny. We're done. All right, we're going to take the questions you have. I'm going to take them face to face. So type up your questions for me. I'm going to show you, we're putting in some betadine solution. Still a little concentrated there. I would do half of that. All right. A little betadine, which is an antiseptic. It kills any germs that might have made their way in there for some reason, which of course there's no germs in there, but you know, in surgery sometimes germs get in somehow. We don't know how. We've never had an infection in our surgeries ever, and none of the laser surgeries, but it's always good just to take a precaution. It's standard operating procedure. This is the blood. We've lost the whole surgery, folks. It's literally just 2 drops, maybe 3, and that's it. And this patient's going to take 1 hour to recover, and then he's going to go home. And he's done. His neck pain will be gone, and he won't need to do anything more for his neck pain, unless, of course, he has facet pain, which he did not have facet pain when I examined him. But, you know, you never know. Some people end up showing the facet pain, unmasking it by fixing the disc pain. So we'll just have to wait and see. 25% of patients that we do the laser surgery on their neck, they also have, you want to turn the suction on for a second? They also have facet pain.
Suction, please.
I'm just going to suck up like heron here so it doesn't go on the floor. All right, good. So 25% of patients that we fix their disc also have facet pain. We don't know that necessarily until after surgery. When they come back and they say it hurts to turn to the side, then we know it's facet pain. All right. Let's just get a picture of this here, guys. This is a 4 millimeter incision. 4 millimeters. You guys see that?
The light is a little bit in the way. Is there a way just to move that
the light,
just,
please.
just a tad?
Oh, wait, it's that way.
There we go. Perfect.
Okay.
We see it.
4 millimeter incision. Put a little pressure for a moment, and we're going to put a steri strip, and we're done. Go ahead and type up your questions. I'm going to come answer them face to face because we've just fixed 2 discs, C4-5, C5-6. We found a lot of inflammation at the back of the disc. That's the source of the neck pain and the pain radiating into the shoulder in this patient and symptoms in his arms. It comes from inflammation getting onto the nerves right behind the disc, and that explains the nerve symptoms down the arm. And it also causes headaches in a lot of patients. About 2/3 of our patients with herniated discs in the neck with neck pain also have pain going up to the back of their head. It's called the cervicogenic headache. Again, all this has been discovered and proven at Duke Spine Institute about 16 years ago when I first described these things. And we've been trying to raise awareness about it to the public. Don't go out and get a stimulator. Don't go out and get a fusion. Don't go out and get an artificial disc. You don't need any of that. We do this naturally with the Duke Laser Disc Repair. All right, Henry, I'll be over there in just a few minutes. So if you want to show a testimonial or something, that would be amazing. And good morning, I'm Dr. Duke Magin at the Duke Spine Institute. I'm here with my patient who traveled to Duke Spine Institute with a couple of problems. She had neck pain from a herniated disc and facet joints, and we fixed both yesterday. She's here less than 24 hours after her surgery. She went home, back to her hotel with her family afterwards, and she came back in for a quick checkup. You can see the incision for her surgery is 4 millimeters. It's tiny. How do you feel today?
I feel good. A little sore from surgery, but that's normal. I'm so much better. I could just feel that I've been fixed, and that was not gonna happen without you.
Well, how did you hurt your neck?
I got into a motorcycle accident back in October, and it flew off the bike.
And you've been suffering since then.
Yeah.
Why did you decide to come to Duke Spine Institute?
Do you have enough time?
Sure.
I came here because I was told that I had to have this really invasive surgery. They wanted to do a discectomy.
And fusion.
Yeah, and I was very scared. I was very scared, especially after reading what could happen, the risks. It was just too much, and actually kind of scary, because when I looked into the doctor, he actually had a lawsuit against him, which the people who suggested him to me were not aware of. So I kept doing my research. I thought, well, maybe I'll just figure out how to do some exercises to help my herniated disc, which, yeah, now that I know what I know, that's not gonna help your herniated disc. Nothing is gonna put that stuff back in your disc.
That's right.
So I did 6 months of physical therapy. That was unsuccessful. I still had pain in my neck, and it was really bad. I would turn my head anyway, and I would always feel the pain right here, feel the pain in my C6. I couldn't do the things I normally did. So when I did my research, trying to look for exercises I could do to help my disc, he popped up on my feed and said, "Do you have a herniated disc? I can fix you." And the more research I did, I was just so thrilled, because nobody has his impeccable record. No one. That's why I went to him. He knows what he's doing. He is crazy confident. His staff is amazing. They're so kind. They're so attentive. The lady that did my IV was so gentle. She did it, and I was like, "You're done already?" The people here are amazing. This doctor knows what he's doing. God has his hands in his hands.
Amen. We are so thrilled that you were able to get your neck fixed here and avoid that metal plate and the fusion and the discectomy, which is totally unnecessary, by the way. I'm trying to help people understand the truth. There's no need for ACDF fusions anymore for degenerative disc conditions. We can fix it with the Duke laser disc repair and the Duke plasma rhizotomy. You can see in your video here, we went into your disc, we used the laser. We actually pulled out several big chunks of herniation. I don't know if you watched your surgery, but you could see them coming out from the back of the disc. I cleaned the back of your disc beautifully, got the foramen opened up. There was nothing in there when I was done. Now your disc is going to heal naturally without any problems. Is there anything you want to tell the rest of the world out there that you haven't already said?
If you're in any kind of back pain, any kind of neck pain, he's the only option, because he knows what he's doing. Really, he can help you. He's helped people get out of wheelchairs. He's helped people be able to ride horses again. I mean, I'm gonna be able to go back on a jet ski. I'm gonna be able to go back to my life. Obviously not right now after my healing time, but I wasn't gonna be able to have that happen before. And I'm an adventurous person. So if you're an adventurous person, if you're in pain, if you want your life back, you need to come here. You need to come here. You will never regret it. You will never look back. I promise you with all of my heart. He's the one you need to be with.
Well, congratulations on taking the faith and getting it fixed.
Thank you. Thank you so much.
You're welcome.
You've made me so happy.
You have a beautiful family. Please tell your husband I said hi. He's a very smart man.
Absolutely.
And I'm very happy you're doing well.
Thank you so much.
You're welcome. All right, take care.
You too.
Let's get you out of here. Welcome. I'm glad you enjoyed that testimonial as much as I did. Our patients do phenomenally well at Duke Spine because we target their source of pain and we fix it with the most innovative, latest technologies in the world. Actually, all of them have been developed here at Duke Spine Institute by myself, the founder, and hopefully we'll be in business for the next 100 years fixing people's back and neck pain. But we do need support. We need support from our viewers, our patients. We're a very small company. To be honest, overhead is very high, and without support from our patients, we would not be in business. We're not a big company. We're not a big hospital or institution. Remember, the hospitals like the other types of surgery that put metal in you because they make a lot more money for those procedures and they're more profitable. The companies that teach surgeons how to do spine surgery are promoting all the implants, the stimulators, the spinal cord stimulators, the metal, the screws, the cages, the rods, because they make a lot more money profit when they do those procedures. The Duke laser disc repair unfortunately doesn't make money for anybody, like the hospital or the implant companies. It's a I don't know, what do you call it? A treatment that doesn't enrich the industry like these other treatments do, and therefore they're against it.
Yeah.
They don't support it. So we're sort of on our own because we're doing treatments that are better for the patient but not better for hospitals, the industry, or other surgeons. So we're sort of the black sheep in the industry, but I made a commitment being a doctor that I was going to do what's best for my patients, not what's best for the hospital, not what's best for the implant companies, and not what's best for other surgeons. Unfortunately, the truth is these surgeons have been bought and paid for, and there's about 10% of spine surgeons that control the other 90%. And those 10% are bought and paid for by the companies and the hospitals, and they're pushing these treatments that don't work because they want you to stay in pain. They want people in pain. If you're in pain, then you're going to keep coming back and getting more treatment and making more money for everybody. I don't feel that's ethical. That's not correct. That's immoral. That's wrong. It's not what doctors should be doing. Doctors are supposed to cure disease, not prolong it. So I am unfortunately a total black sheep in this industry, and we don't rely on hospitals or implant companies or other surgeons to tell you about the latest techniques to cure your pain. We do it ourselves because we can't rely on other doctors. They don't do it. They don't do what's right. Okay, they just don't do what's right. All right, we'll take the questions.
Yes.
But the surgery went perfect. You could see the tears in the back of the two discs where the jelly was starting to come out, causing inflammation and pain. We cleaned them up with the laser. They went beautifully. We had no complications. We lost 3 drops of blood. And this patient's going to go home in about 45 minutes to an hour. Let's take the questions.
All right. So this first 2 questions coming from Lanu on YouTube. First question they're asking is, what's the difference between live stream versus video streaming? Both look the same. I can answer this. Live streaming refers to broadcasting video in real time as an event happening, while video streaming encompasses any type of video delivery over the internet, including both live and pre-recorded content. So you can call this a video stream, but it's obviously, of course, live as we're doing it. So you can call it a live video stream.
Yeah. So Henry just answered that for you, Lanu. We do live streaming, which means our surgeries are live and you're watching them as they're happening. We don't delay the stream. We don't edit. We don't change anything. You're watching the actual surgery happen as it's happening. You're watching it through the eyes of the surgeon at the same time the surgeon's watching. Mm-hmm. The reason we do that is, number one, I could take questions and answer at the same time, whereas it's more difficult to do with other types of streaming. Number two, you get honesty, pure honest content, meaning we're not hiding, we're not doctoring, we're not manipulating or changing anything you're seeing or hearing. It is real. It is reality TV. It's happening. I mean, better than reality, because reality TV is fake.
Yeah, yeah.
Yeah, and they edit it. But this is live. This is the best you can get as a viewer, because you want to watch what's happening as it's happening. You don't want people to hide the truth from you. And this is as honest and open as a stream can be.
And then next question from Lanu once more on YouTube asking, did this patient have a herniation for a long time?
Yeah, did this patient have a herniation for a long time? The answer is yes. You don't get that much calcium and scar tissue if you don't have the herniation for at least a few years. You need about a year or 2 to get some scar tissue and calcium. If the herniation is only a few months old, you're not going to get much scar tissue, you're not going to get much calcium. You could have swelling and inflammation and pain, but you need a herniation for several years to get scar tissue like we saw with this patient, and calcium. I would say his herniations are somewhere around 3 to 5 years old, and he's had pain for the last 2 years.
And then coming from Jack on Facebook,
asking, hi doc, will herniated C4, 5, and 6 be likely cause of constant giddiness while standing or walking? Other than the constant giddiness while standing or walking, the arms and leg motions are all fine per normal?
Yeah, so Jack, I don't know what you mean by giddiness. You asked this question, I answered you on our YouTube channel already. Giddiness means
Yeah, that's what I thought.
herniated discs do not cause that. There may be something else going on, but not herniated discs. If you're asking about trouble with your balance or coordination, and you're calling that giddiness, then yes, herniated discs compress on the spinal cord and nerves and cause balance problems.
No current questions, so we do have a comment coming from Janet on Facebook saying our government lets them lie and deny care, talking about insurance companies,
Yes.
and they pay off our politicians. It
Yes.
is terrible that everyone doesn't have the ability to get your kind of treatment. Share, share, share. It's all about money for them. You are awesome. Dr. D.
So Janet, thank you. You are correct. Big industry is so corrupt. It's bribed our politicians and our government in the United States. And I'm going to tell you something. It's not just spine companies that have done this. It's also happening in other areas of medicine that have nothing to do with spine, but we call it the industrial complex. And one example I'm going to tell you right now that really upsets me the most is the Veterans Hospital, the VA hospital. The VA hospital is set up to take care of our veterans and active service members who have medical conditions. And it's supposed to be a place for them to go to get quick, affordable, accessible care. Basically, it's free to them. But what's happened is, because when you go to a hospital as a veteran to get medical care and you're not paying for it, you're going to go there and you're going to want treatment, and you deserve treatment and you should get it right away. But what it does is it costs our government money. And when the government is spending money on the VA vets paying for their medical care, they can't get kickbacks with that money. There are no kickback schemes they can do. So the politicians have to find other ways to get kickbacks. And one of the biggest scams in medicine right now, besides the spine and other treatments, is something called electronic health records, or EHR. If you look in the news, the VA hospital is spending $16 billion on a medical record system, which is, you click on a computer, you can open up the patient's record and you can see their diagnoses and medical problems. I'm going to tell you something. I worked in the VA hospital for 7 years before this EHR scam happened. This was back in the 90s and early 2000s. The VA system had a medical record system called Meditech. It was the best medical record system anywhere, Meditech. You could pull up the labs, you could pull up the images, you could pull up the reports, you could pull up all the diagnoses, all the treatments, all the clinic visits. It was perfect. Nothing wrong with it. But somehow the corruption of our government had said, let's spend this $16 billion on a new medical record system that, by the way, does zero treatment for the vets. So vets that have hip pain, they can't walk, vets that live in constant pain, they cannot get medical care because there's no money, because the system is set up at the VA to basically delay their care, deny their care. I tried when I was at the VA hospital as a neurosurgeon, my entire department, we tried to get more office visits to see more vets because the backlog was 6 months. We didn't want vets waiting 6 months for neurosurgery. If you have a brain tumor, you shouldn't be waiting 6 months to get in. So we tried to get more vets to come in and open up the schedule, see more of them and take care of more of them. The administration said, no, we're not opening the schedule. This is a set schedule, we don't open it. It is a complete lie and a scam, and the American people need to know the truth so we can fight the politicians, we can fight our government and get what we need. These vets should not be living in pain. They have completely fixable problems. The only thing preventing them from getting fixed is the system, the VA system, which is corrupt, just like many other systems. And basically, they're not letting these vets come in and sooner and get surgery sooner. The backlog for hip surgery at the knee surgery at the VA when I was there was 2 years. That's after you got seen in the clinic and were diagnosed and needing a hip replacement or knee replacement. It was 2 years before you can get it. They just want you to die. Most vets are old. they're hoping you die of a heart attack so you don't need the surgery. It's crazy what's happening, and it's corrupt and it's wrong, and it is so easy to fix pain and get people out of pain nowadays. We have the technology, we have the know-how, it's cheap, it's easy, it's 100%, it's a cure, and there's no reason people should be living in pain. So yes, we need support at Duke Spine, and we created a new center called Duke Joint Institute to cure hip and knee and shoulder pain in arthritis patients to avoid artificial hips and knees and shoulders. But you know, the more you support what we're doing, the more further we can go, the more we can achieve. But really, it's all about getting the word out. So if you can do that without supporting us, fine. We don't care. We don't need your money. We just need the word to get out so that people have hope, they know where to go, and they need help.
And then we have another question coming from, or just a question coming from Trinette on Facebook.
Hello, Trinette. Welcome.
Asking, what do you think of burning the nerves for pain? Is it so it is so painful and does not last long.
Yeah.
What options do you prefer?
Trinette, you asked a beautiful question. Thank you. And maybe Henry can line up the video since we're still streaming, right?
Yeah.
And I'm going to answer this, and then we're going to show you the video how to do it. Burning the pain nerves only works for facet joint pain and sacroiliac joint pain. We're about to do a surgery right now next, which is going to be burning the nerves to the SI joint on a patient, but he's in room 2, so you're not going to see the surgery because we don't have a camera system in there. But the point is, the RFA procedure you're talking about, radio frequency ablation, it doesn't work half the time. It doesn't last when it does work. So 50% doesn't work, 50% does, but the 50% that does, it wears off. Why? Because they want this to wear off. There is a way to do it permanently. It's called the Duke plasma rhizotomy. I figured it out about 3 years ago. We've been doing it for now almost 4 years actually, and it's a permanent burning and cutting of the pain nerves so the pain never comes back. But it's only available at Duke Spine. The reason these other doctors don't want you to have it done, they don't do it, they don't know about it, they don't promote it, is because they want you coming back. They want you to stay in pain. If you keep coming back, they keep making money. They are treating patients like an annuity where you keep coming back and making them money. It is wrong, and that's why we're doing this. We're trying to raise awareness about this. Come to Duke Spine. We can do it for you. It's permanent. You just have to fill out the MRI review form on our website. It's a free MRI review. We don't charge for it, and we'll give you a diagnosis. We'll tell you if it'll work or not, and then you can come here and get it done. It literally takes 20 minutes to do. We put you to sleep, and it's permanent relief. All right, we're going to show you that video, and I don't think we have any more questions.
We do have one more question.
All right, let's take the last question, and then we'll leave you with the video.
No worries. Coming from Jack once more on Facebook saying, thanks, Doc. Also, is discoplasty a type of laser procedure too?
Yeah, discoplasty can be a laser procedure, but it doesn't work because they're not using a scope, they're not finding the tear, they're not removing the herniation. Discoplasty is they just stick a needle in, they put a laser down, and they burn randomly, but they're not treating the actual pain source. That's why it doesn't work. All right, everybody, we're going to show you this video, and we'll be back with a very big surgery, 5 levels, 5 discs being repaired, 3 are thoracic, 2 are lumbar. We're going to break it up into thoracic Duke laser disc repair. It's a T910 bilateral and a T1011 on the right side. So 3 discs in the thoracic spine. And then we're going to do a 2-level lumbar, L1-2 bilateral. So we're going to break it up into 2 streams. That will be the next. That will be in about an hour.